Good afternoon, everybody. We are missing the chairperson for this session, but I don't think that should hold us from holding the conversation. So we just go ahead, and I think it's a good opportunity to really talk about knowledge and access to several reproductive health services to prevent HIV among young people. And when we look for the family, I think it will really be great, to hear from them. So I think we have two of the speakers, and so I'll start with Joseph, and I think you just take a motion to introduce yourself, and then just take it up.
Thanks, Tansu. So, like you say, my name is Joseph Joan. I work with Nigeria's Government Trust.
Waiting for the slide. All right, I think just go ahead and do us. So please continue the slides that are on the board.
So my slides just came on.
All right, thank you, Joseph.
So I'm going to be speaking around knowledge and access to safe reproductive health and rights services to prevent HIV/AIDS among youth. So I think I'll start off by talking about what you already know. And the first thing is about 60% of Africa's population is under 25. Fact. When we look at the sub-Saharan region, we know that we continue seeing high rates of maternal mortality compared to other places globally. The third key thing is teenage pregnancies and child marriages continue to be a real threat to the rights and health and well-being of girls around Africa. The fourth key fact is when we look at the 995 agenda, adolescents and young people have not actually done well compared to other demographics. The fifth key thing is resources, especially around HIV prevention and control, are continuing to decline, as we already know. Then I think the last big statistic is around women and girls comprising 63% of HIV cases, with adolescents, girls 3 times more affected compared to their non counterparts. So, in this sense, I'm just going to speak to 5 key points that I think could help us as we are now putting towards the 295 targets and agenda certificates. The first key thing is we need to show confidence in the capacity of youth to believe. I think it goes without saying that when we talk about how we've done, that's a key gap that we need to really concentrate on effort on. The second key thing is we need to ensure that our representation of young people in decision-making spaces is actually meaningful. Thirdly, we need to set that implementation space for youth-led organizations and networks. The fourth key thing we need to do is to prioritize youth-driven social behavior change communication models. And lastly, we need to create an environment for access. So the first key point around confidence in the capacity of youth to deliver. The first key thing I'll speak to is safeguarding access to resources, especially in national programs. In countries, I think we've had a number of programs coming. I'll just mention DREAMS, and I'll use DREAMS as a proxy, not to say that DREAMS has not managed to do this. But if you look at how we have used the AI model and not actually managed to set that space for youth-led organizations, and what that would look like, it means by the time the youth program was coming in different countries, we needed to know what was the percentage of that grant that would go directly to youth-led organizations and networks. Just using that as an example. We need to start facilitating access to long-term grants to youth-led organizations. And this will spill over into the third key thing around investing in institutional capacity building. We can all agree that COVID-19 hit so many organizations very hard, but the conversation that never happened is, did youth-led organizations actually make it from that point? And those that did, they're probably even today still on life support. And these are conversations that are actually not happening. The last key thing is we need to think through how can we establish meaningful youth partnerships that can transcend beyond event-based participation. So that would look like, how do we ensure that as we are developing, it might be proposals as we're doing the work, how do we ensure that young people are coming on the table as equal partners? So the second key thing we need to do is ensuring representation in the ICC training spaces. Often at times when we're thinking about setting up these structures to decide on resources, policies, and strategies, we come up with terms of references, we come up with policies. Half the time, young people have to come back to remind you that you miss young people. And that is also if we're willing to listen and then accommodate that system to begin with. I'm not sure why we're not alive to the fact that as soon as we're even conceptualizing these structures, we need to have basic covered. The next key thing is we also need to strengthen the capacity of adults around working with young people. Many times the conversation has always been about capacity. Even this resource conversation is capacity. I think the capacity or the responsibility is on the adult partners on how best they bring in young people and leverage on their expertise as much as possible. Just as an example, I know our adults struggle a lot with technology, but when you go and engage with children, do you see the energy and the zeal that they have in educating on how to navigate a certain application with the internet? Please, let's learn also transcend the same energy and effort when we're working with young people. The third key thing is around the operational guidance. Some of the spaces that we bring young people are actually not youth responsive. A good example is, as a young person, if I'm getting into a space with directors, and I'm using this as an example, and perhaps the reinvestment to support accommodation meals will come, after the course is happened. What that means for young people, especially girls and young women, is I'm probably coming in there not adequately empowered to actually navigate that space as they should. And all these things, we need to think through them on how best we can ensure that we get from young people. The second last key point is around engaging young people as equal partners. And I think it ties into the capacity question. So when we bring in young people, are we bringing them in to fill a space because it makes us look good to have young people, or really go through how they can add value in terms of the agenda that has been set in that particular structure? Lastly, we need to monitor and evaluate, and I can't stress this enough. The third component is around safeguarding implementation space for youth-led organizations. It goes without saying that our resources need to also follow that quest. And I'll keep coming back to the DREAMS example that I gave. In the countries that have managed to do this, congratulations, but there are also countries for the past probably 7 years now that have been implementing DREAMS. There is no youth-led organization that is part of that consortium. What are we doing to begin to change this narrative? The second key point I'll speak to is around youth responsive grant-making approaches. We always argue capacity, but we're not willing to invest in building this capacity. Most of the grants that they come in end up being short-term or short-lived grants, and that capacity always remains a pipe dream. So we need to think through models that can begin to build organizations. If you are starting from a point where you're doing activity-based funding, by the time you finish, you need to be comfortable enough to give the youth-led organization a 5-year grant. The third key point that I'll speak to is around creating safe spaces for young people to lead. Half the time when we're bringing young people in spaces where we decide on critical issues, we never actually do that. And I'll probably talk about the global fund writing process. I think we understand the promotion that happens here. Firstly, when you even talk of representation, you're probably having one young person who's having to navigate all the program areas that you are going to be looking at. And is that really adequate? That's an indicator which is showing that we're not thinking through what really youth participation looks like. The last key point that I'll speak to is around how do we also recognize some of the volunteers that are working in our organization. Many opportunities emerge, but are we ready and are we willing to ensure that when those opportunities emerge, we give better roles and better responsibilities to the volunteers that are working in the established organizations? So the second, my third and last slide is around youth-led and youth-driven social behavior change communication approaches. I think this really speaks directly to now the work in itself. So 3 components, I think as you already know, we need to ensure that we have advocacy, community mobilization, and behavior change communication. I think at global level advocacy piece, we need to ensure that we have active support from stakeholders. Half the time when young people are engaging, they identify so many problems, so many challenges, but they do not have the support. Where are they going? Where are they referring these challenges to? So our advocacy needs to be around organizing and mobilizing, which ties into the community mobilization component, where we set up task forces with willing stakeholders that are available to ensure that whenever there's a need for a service, whenever there's a need for an intervention, that is being provided. And I'll speak on behavior change programs. The one thing we've not done enough is to focus on the values and the attitudes. Yes, we give a lot of information, but at the end of the day, what changes behavior is tailor-making our model to speak to values and attitudes, because that is the basis in which we make decisions. Even when we come back to the capacity building sessions that we have with health providers, some of the reason why we continue to see young people saying services are different is because the models we're using are not addressing the values and attitudes of those health service providers. So my second last slide, which let's speak to the access component. I think we need 4 critical enablers. The first is ensuring that we utilize available sectors. The good thing about using sectors is we have young people when they're already mobilized. So this is perhaps within the schools, tertiary institutions, farming and rural communities, and mining communities. But the essence is we need to leverage from these sectors and then ensure that we integrate the message around improving risk perception and so forth. The second point is on removing structural barriers, specifically looking at policy and legislation, user fees, and I'll speak to user fees. We've had opportunities, especially when we're coming up with the laws, to think through how best can we make it the responsibility of the state to pay for user fees for certain demographic populations of young people. I'll talk about young people with disabilities as an example. Young people living with HIV, often and vulnerable children. So we need to think through how best can we get government to commit to ensuring that whenever an orphan walks into a health facility, it is the responsibility of government to ensure that whatever services that they need, they can then access that. So before we even remove these barriers, we're still going to be seeing access gaps across the board. The third point that I'll make mention to is around the service package. I'm happy this previous session was speaking around choice. We need to ensure that the range of commodities that we have allow young people in their diversity to access the products that they need at the right time, at the right place, depending on their context. And lastly, we need to begin to engage young people when they come in for services as clients. Often at times, the cultural and the social dynamics come into play, and this is how we continue using young people from services. And it comes back to the point I made earlier on around the packages that we have that are training health providers. We need to ensure that we speak to the values, we need to ensure that we speak to the attitudes. My last point is around safe spaces for assets. We've seen in the key population that whenever we have a space that is dedicated to key populations for accessing services. They come in their numbers. The same applies to young people. And we need to really invest, whether it's a youth hub, whether it's a youth center, whether you want field rate and have another name for it. But the bottom line is we need to have safe spaces for young people where they can come in to access health services. So in conclusion, I think showing confidence in youth, show us the money, then we know that you're confident. Before you do that, it also means that most of what we're doing is tokenistic. The other thing is let's then create space where young people can decide where they're engaged with the core partners. So I'll just end by saying investing in young people appears to be difficult, but when you do it right, the dividends are great. Thank you.
Thank you very much, Joseph. To those 5 points in facilitate access and sustainability program to a comprehensive sexual reproductive package enriching and prevention and support for young people. I think is really giving a lot of quite some very direct pointers in terms of the gaps that really need to be addressed. And welcome to all of you. We are innovating access to sexual reproductive health services to prevent HIV amongst young people. So we hope picking up all the points because we're going to have some time for engagement. Otherwise, at this point, we can go over to you, time.
Thank you so much. It's a very hard one to follow up such as presentation because a lot of things that you highlighted, we all know are the issues. I'm all very clear.
Okay, thank you. I think this is what it is. You've shared a lot of data and stats. We all know what's inside the continent for young people. It's a very beautiful continent, and in some of our countries, like I come from Nigeria, our youth population is anemic and is growing. And so we know that if there's anything to be said about HIV prevention and ending AIDS by 2030, it cannot be achieved without, capturing this youthful population. And we know what the issues are with significant vulnerability of young people to HIV infection. We know there's many reasons for this. There's a lot of misinformation that's rising around amongst young people. We don't have adequate knowledge about HIV prevention, sexual reproductive rights. We don't encourage open conversations because of our social-cultural environments. We don't encourage open conversations around sexuality and sexual reproductive health, around sex. Some of us would never hear it in our homes, ever. And then we get to hear it maybe from friends. Some people in some countries, depending on us, they might hear something from school. But even that information sometimes is not sufficient. There's also low risk perception amongst young people, especially with the focus on the treatment, treatment cascade in the last many years, and the reduction of focus on HIV prevention messaging. So we are seeing a generation of young people that have a very low risk perception when it comes to HIV and even other STIs. There's many issues with that. But yes, even with the global targets on HIV prevention, we know that increasing access for SRH information for young people is still very key, especially through comprehensive sexuality education. In addition to that, addressing issues of stigma and discrimination is also important, and ensuring that those who are high risk, including young people, have access to prevention interventions. We know very much from what we do, our experience, research, that when young people are informed, when they have access to sexual reproductive health, they are able to knowledge, they have confidence, they have skills, they are able to make informed choices and informed decisions. And they know about their bodies, they know what the do's and don'ts, they know what the boundaries should be, and when they're faced with those difficult and challenging situations, they are able to make the right choice based on the information they have. In terms of the barriers to accessing information and services for young people, we know that legal and policy environments play a key role to what can be made available for adolescents and young people. And so we have seen also that in many countries in Africa, the legal and policy environment is not very supportive. We still have laws that are restrictive, for example, speaking about the age of consent for accessing HIV prevention services. And so this is something that still continues to pose a challenge. And I know that it's connected to the issues around social cultural environments as well, because the people who are policymakers and decision makers are also our people. And so when they are in those positions of power, the decisions they make, the policies they make reflect sometimes their personal preferences and their biases. So we find that if for example in our country there's still going to be you still have to be 18 before you can independently access some services or legal services. That's really limited to how much access they can have. We also have issues of poor information, like poor access to information generally. Like I said earlier, the sources of information for young people, they are diverse. There's just so many ways that they can get information. But the thing is, where are they getting accurate information? Where are they getting facts? The ones that really will save their lives. The people who have the power to do this, are still working with lots of, oh, this is not for young people, this is not for this age. And we're still having the kind of data that we're reporting on teenage pregnancy or HIV transmission amongst adolescents and young women. So there's really a challenge on how much information exists. And I know that this session is about young people, but you find that people with over 50 women. So when some people say things about sexual and reproductive health, you wonder, has this person never had this kind of information? But it's the reality of young people in our current continent. CSC is still a challenge, and I speak to CSC specifically for the education setting. Yes, we acknowledge that young people are in school, they are out of school. So for the ones that are being privileged to be in school in many places, we don't offer comprehensive curriculum. And so it's many of our countries are very national based, or even where it is still in existence. And we know that the schools are a good opportunity to really capture young people, to engage them, to teach values, to teach them skills, life skills, to teach them how to relate with one another, to get them to understand their bodies, some people that they respect as well. So we need an opportunity with how CSC is being implemented in our countries, of actually providing life-saving information for young people. There's also the issue of gender inequality. We see the disproportionate rates of HIV infections when it comes to adolescent girls and young women, especially in our own region in West Africa. And we know that some of this is also due to gender norms, negative gender norms and stereotypes that exist that give rise to things like gender violence and all other kinds of other ways in which unequal power relations negatively affect girls and young women. We also know that stigma and discrimination is also an issue. And I'll insist on that in terms of where people are young. In our environments, in our social cultural environments, young people are not seen as human rights. So we don't see them as people who should offer like respect or speak to respectfully or engage respectfully. And these things in the entire ecosystem comes together to really pose a huge challenge. So in terms of how we move forward, because we already know all of these problems. So for us, we know that comprehensive sexuality education cannot be emphasized as key. We know that it's also important to improve access to commodities. In the previous session, we were speaking about all the different options, but also talking about condoms, right? We know that while there are many options for HIV prevention now, in terms of sexual and reproductive health, we still need to push, the messaging around, sexual and reproductive health commodities like contraceptives and condoms especially for girls and young women, and ensure that these commodities are also available and accessible to them. There's also, provision of different services. You said something about this. There are minimum standards that should guide the provision of services for young people. And we find that sometimes, if maybe like in our country, the UN is not pushing it, the Ministry of Health they have the documents, but they are not so big on the pushing for implementation. They will cite things like resources, shortage of resources as a challenge. But we find that it seems like maybe it's maybe the United Nations mandates, to push for, implementing minimum standards for providing health services. But this is something we should advocate and push for our governments to own. That across facilities in the country, the same standards of health. Because we know the issues, why they are not doing them. We know that there's provider bias. We know that the environment is not welcoming. It's not affirming for young people. And it's not the place that we know the kind of young people, in this generation. It's not the kind of place that is appealing to go and ask questions or even obtain services. So we need to push that these minimum standards are upheld, across whether the districts or the counties at all levels of facilities in our countries. And there's also the issue of community engagement. When we talk about the social cultural issues, young people don't live in isolation. They come from homes, they live in communities. And a lot of the issues that they face, with access to sexual reproductive health is also cultural. So we need to go to the levels of the community leaders, the traditional leaders, the faith leaders, and start to engage them, and start to interrogate, maybe not interrogate, but just interact with and engage on those things that are their fears, those things that they feel, we don't want these young people to know this or know that, and help them to have a better understanding of the importance of providing a safe environment and a living environment and a supportive environment for accessing information and services. So in my organization, we have found, for some years now, we've been using technology to provide information to young people. We've had support of many stakeholders, including the to use basic SMS and toll-free lines to provide counseling support, to provide SRHR information. So we have a microservice service, and people will call and ask for a questions, or send an SMS for free and ask for whatever questions that we have. And there's a counselor who provides factual information. This is an example that I want to show. We also have an Android mobile app called FaceKey, so in the store. That's a bit more comprehensive and has lots of information. For us, this is one way that we want to see that we are equalizing the access to information. If you cannot get it from maybe at least you can get it from this other source, and we are sure of the information that we're providing. I'm trying to summarize. In conclusion, just to conclude our thoughts, we know that we can't address HIV, then we don't talk about young people and we don't talk about SRHR. And it really has to be from a multi-sectoral perspective, a multi-sectoral collaboration, a multi-sectoral approach. It's not something that's just for the Ministry of Health, we need the Ministry of Education, we need the Ministry of Gender, and whatever it's called in our country, we need the Ministry and Parents for Youth. We need them to come together and have a comprehensive way to address these kind of issues. We also need innovation, thinking about the ways that are not the usual ways. What are other ways that we can reach young people? A lot of them have access, not so many have access to technology that we want to, but there's still a significant amount of young people who are in the tech space on social media and have some level of access. We need to do more with using these platforms to provide sexual and reproductive health information. We need an enabling legal policy environment in our countries, in our regions. There are already some good policies. We know that many countries have some policies. So for the ones who have these policies, we're telling our government to implement them, have the courage to implement what you have put down. There's lots of commitments also in our region. There's a commitment in the SR and the PCA regions for education for health and well-being. It covers the whole range of subjects that can support young people to also have a wholesome experience as they're growing up and not be and not have this kind of issues and barriers that can hinder them from making progress in their lives. Speaking about well-being, yes, we know there's not just one way to address the issues of young people. There are other things that are important to them. There's economic issues, there's mental health issues. It's not for us just going to those communities, going to schools and just talk about sexual and reproductive health alone. We need to think about what the things that young people are dealing with in today's world and how it affects their bodies and how it affects their bodies, how it affects their relationships with one another. And of course, we know that if we provide young people with knowledge and information, that yes, they will be able to protect themselves, and it is possible to reduce the incidence of HIV and improve sexual and reproductive health for young people in Africa so that they can reach their full potential. Thank you very much.
Thank you very much for playing all of the reminders of the ongoing areas to really making sure that we maximize the opportunities of ensuring that young people have access to this. Here, you've been reminding us just about a lack of understanding of young people and their self probability, perception of HIV and discharge. Then you also reminded us about the barriers that are thriving in their restrictive laws and policies in our countries. They are working along with the cultural perspectives and practices in the communities. I think it's so interesting to hear the work that international as we try to address this. So we hope we have just about 7 minutes to go. Young people who are here, this discussion is kind of the most important to you. You agree? Or you have some of the things that you really think are very important, because we have had these presentations from both from Nigeria and Zimbabwe about a lot of these things and how it is that we can continue to strengthen access to HIV and sexual reproductive health services. Please, can people with microphones stand up, please, so that you can see hands. There you go. There is the first hand, another hand. Right, take a break there, don't do that hand. You can take another hand. There you go, right there. So in that order, please. Introduce yourself before you come, please.
All right, my name is Saito Gatenga. I come from Malawi and I work for Equality Africa. Thank you so much for the really great presentation. You shared a lot, and I definitely agree. I just wanted to add to say we should also actively work towards accountability. So a lot of people say young people, but how are we holding our duty bearers accountable to the commitments they make? Most African leaders go out there, 2 weeks at a convention, 80 delegates, sign documents, come home, and there's no actual implementation on the ground. So we have to make sure that we're holding them accountable for the commitments that they made, to make sure that they're fulfilling those in an attempt to bridge the corruption gap, and also make sure that the literature that is being produced is actually being used. Because there are a lot of policies for there's a launch every other month, but what exactly are we doing with that literature? Thank you.
Thank you, sir, for that message. Right at the back. Or maybe stand up so that they can see which microphone they need to.
Okay. Technology is doing the thing. Thank you so much to the presenters. My name is Jimmy Tata. I'm from Zen. One thing that resonated with me the most, and let me first step by appreciating that even from Nigeria far into the African continent, the issues that young people are facing are similarly the same. So for me, from the presentations that were being made, one thing that resonated with me the most was issues to do with building the capacity of adults in terms of appreciating and acknowledging meaningful youth participation. Many a times as young people, we scream for spaces, and when we're given the spaces, the environment is what's up for young people to actually participate. That's one. Secondly, for me, I think also Joseph mentioned on it, is issues to do with financing of building the capacity of young people. I like how whenever we have meetings, we talk about meaningful youth participation and building the capacity of young people. The question I always ask is, where's the money? And we put our money where we put it, so that at least the meaningful youth participation follows the capacity.
That is what I was trying before. Just do your best.
Good afternoon. Sorry. I'm John McLaren from Zambia. I want to draw it from public health perspective to business perspective. That's how I'm going to approach these issues. I realize that we've talked about, hello? I realize that we've spoken so much about the public health intervention, that I will draw into business model. The business model that we're going to look at when we're designing our intervention, we are going to look at the 5 service gaps. The first gap, we have to look at the knowledge base. What is the gap in the knowledge base? The second gap is going to look at communication. The communication base, then we are also going to look at the youths as customers. The youths as customers, how are they going to perceive the service that we are going to have? I like the gentleman from the one who presented first, where I say if we have to plan, we need to plan with the users, in this case, the youths. And in this case, for me, I believe that the youths have high expectations. I tell to when we design a system, that system, when we want to implement the program, finally, we have also a delivery gap, service delivery gap. If I say I'm going to distribute condoms, I sensitize the youth about the condom. The following day, the condom is not there. So I have created a problem within my design. Thank you.
Right. So we see that there are more hands and we have 2 minutes, but we will, what I'll do, I'll give to you, Oluwatoyin and Joseph. At least, I mean, those were remarks from young people. We have Zimbabwe, Malawi, and Zambia represented in those voices. I don't know if you have a few responses, and then there are hands that are frantic in front of me. But let's hear just your remarks, and then we will see if we are given more time in this room to continue.
Thank you very much. I think I just want to agree with the issue of accountability. When I was speaking, I mentioned the ESA commitments, the WCA commitments. I think they were all this year on education and health and well-being. There's been other things like that. And maybe next year we'll hear about other kinds of commitments. And we need to do more as all of us in this space to start asking the questions, including having accountability strategies for those commitments. And I know that our funders are here and they many times are also facilitating this commitments making on the continent and even globally. And so there's also a responsibility on their part to ensure that there's an accountability, side by side, making those commitments. Otherwise, we'll be here 30 years later, 25 years later, still trying to find, how have we done and not much has been done. So I totally agree with that. And of course, when it comes to the issue of standards and all of that, it has to be done with young people in participation. So when you say the standards cannot be met, if young people were not involved, maybe. But if it is done in a way that you hear from them, you can't be developing guidelines, developing standards for the people you would serve, and they're not part of it. So as far as, the young people are part of it, I don't think the government should come back anytime, or whoever is responsible, to say to us that, it's difficult for us to meet the standards. We agree that we know that they can meet the standards. There are other issues, but we know they can meet the standards. I think I'll stop this way. Okay.
Thank you for the remarks and the beautiful presentation. I think for me, two key takeaways. The first one would be how can we leverage in the potential of functional, meaningful youth adult partnerships. And this is an area that I feel we've not done so well around, because especially on the part of the adults. And in this sense, I say, and I come back to the ability to listen to an idea and improve it. Half the time when we have young people in spaces, we're not really taking time to really understand what they're actually saying. Then you bring it back to the conversations that we already had, which I'm not getting into, around resources, around meaningful partnerships. We can all agree here, using a very simple example, that among the more established organizations, you guys sit together and apply for grants, right? What is stopping established organizations to also take the youth-led organizations on such a journey, on such a process? Because what that does is it strengthens the capacity, and if something comes out of that, we're already covering the resource skill in doing that. The last key point is, whatever it is that we're going to do around young people, our main problem is around addressing values and attitudes. We can talk about this from the perspective of the young people. We can talk about it from the perspective of teachers that are going to be educating on comprehensive sexuality education. We can talk about health service providers. But for as long as we're not designing models that speak to value clarification and attitude transformation, we might continue to miss the mark. Thank you.
All right, the next session here will be at 5 minutes after 3, so it seems like we can continue and use this time. So there were other 3 hands. All right, I think the microphones are on your way. We need one here.
Thank you very much. My name is Awa Fani. I come from Cameroon. Thank you for the very beautiful presentations. I think we have talked a lot about what the adults are not doing. What about what the young people are not doing? We know young people don't like to work. You give them responsibilities, they don't want to take up the responsibilities. So what is our challenge to the young people?
Okay. Thank you. My name is David Namo from Zimbabwe. So I have three points that I wanted to raise. So first, the age of access to services. What are we doing? What is the call? I was hoping we'd have like a call to action. What can we do as countries jointly so that we do not lower the age, but we make sure we have like an age of consent that's acceptable to all across all countries. And then the issue of gatekeepers, policymakers, what can we do to make sure that policymakers understand that youths or young people are equal partners in this? I think it's high time we do a call to action and stop complaining and saying this is what's happening. What can we do to make sure there's traction in that area? And I did not hear anything on mentorship. What happened to mentorship? Is this something we should consider partnering with those policymakers, partnering with those bigger organizations that Joseph was talking about, so that they see that young people are really a partner, an equal partner, and not just involving young people in a tokenistic way. Thank you.
Thank you. One last point. How we challenge young people, and the hands are rising. Not this week, please. But I think we probably won't have time for the other hands. Otherwise, we'll be chased out of this one.
Okay, I'm Dr. Shuma Rasta, UNFA Nigeria. Thank you, Ika, for your presentation. Just a few things to bring to the table for young people. And I think the way Dee brought it out for me is young people themselves should check how they can be accountable. We've seen scenarios where young people have been brought to the table, given funds to work with and to do things with other young people, and there's been mismanagement, there's been distrust. So we need young people to also look within. How are they able, and I have examples I do not want to mention, we have examples from Nigeria as well, all right? So young people working, learning to work together, and when they do work together and somebody is giving funds, that person, how accountable is that young person to the others? That's one. Two, the mentorship thing. I've had cause to mentor young people, I've had good experiences, but I've had other people who would tell you that for a young person who wants to be mentored, in quotes, by an adult, that young person has rules. I'm not saying that on the mentorship, mentor-mentee thing, you would not have what you would bring to the table. But there are certain instances that a mentor may see that going through this route, for example, we want to talk to lawmakers. You can actually have a side meeting or look for somebody that is like a godfather that knows them what you can go through, that carry the placards, that break things, that scatter things. So dialoguing can help. If we're ready to dialogue, we can have answers. If we're ready to also lobby, we can have answers. If we're also ready to bring to the table the statistics in simple terms to policymakers, to stakeholders about what we want, it can also work. Thank you.
Right, thank you very much. So lots of questions. Takeaway messages, a call to action, but how are we challenging young people when they become young people, actually? So again, I think we'll give to both of you and also wrap up with those closing remarks. There's lots to talk about and hope the conversation continues even after this.
Okay, thank you for those submissions. I think I'll speak to the 3 points that Dave raised that I think they're very essential and conversations are already happening. The one barrier that we've continued to face on working on those issues is addressing the power dynamic, which is why when I went through my presentation, that's exactly what I was addressing, because unfortunately, for as long as adults are not willing to give us the space, to give us the power, we're still not going to be able to make meaningful ground. And I think you can even sense around some of these conversations, which ties me back to the accountability conversation. I know established organizations that have mismanaged resources. I know established organizations that have not been responsible. For some reason, this conversation changes when we come to young people. And I'm not sure if it's, again, coming back to the value issue, to the attitude issue. Not all youth-led organizations and youth-led networks will mismanage resources. And I think the onus is on us to come up with systems on how best can we identify organizations that are really true to the cause, that are genuine about the work that they're doing, that really want to serve young people. So it's also about really learning from some of the things that we're not getting right and ensuring that we begin to pull down some of these walls that we have. Even in examples where we've seen organizations, youth organizations performing or doing well, because I know we do have these examples. I'm sitting next to a young person that's just told us that they're working, in a youth space with young people from your country. And I'm not going to really speak too much on that. I think that's a conversation both of you need to have, but I'm expecting to hear that UNFPA has begun to ensure that young youth-led organizations in Nigeria are accessing, they have an enabling environment to perform, really. But the accountability conversation is for everyone. It's not for young people.